Liebe Patientinnen, liebe Patienten,
Dear patients, welcome to this audiovisual lecture about fibromyalgia.
Fibromyalgie herzlich willkommen. Wenn man über Fibromyalgie spricht,
When we speak about fibromyalgia, there are two problems.
das erste Problem ist das Problem
The first
der
problem
exakten
is the
Diagnose.
exact
Das
diagnosis.
zweite Problem ist
The
das
other
Problem
problem
der
is a
möglichen
possible
Therapie.
treatment.
Ohne genaue Diagnose
Without
sind
the
die
precise
Patienten
diagnosis,
der Gefahr
the patients are
ausgeliefert, dass die
exposed to the
Krankheit
risk
als psychisch
that the disease will be declared as mental.
Zurzeit sind Bestrebungen im Gange,
At the moment,
die
one
Bezeichnung
observes tendencies
Fibromyalgie
to suppress the
abzuschaffen,
expression fibromyalgia
den Namen Allodynie
and to replace
zu
it
ersetzen
with the term allodynia,
und als somatoforme
and to
Störung
consider it as a somatic disorder.
Aus diesem Grund ist es wichtig,
For this reason, it is very important to find a classification which will be able to explain the pain syndromes.
die somatoforme Störung ist
Namely, the somatic disorder is exclusively defined in the meaning that it is indicated through the absence of classification.
Systematik gekennzeichnet ist. Sobald jedoch
However,
die Systematik
as soon as the classification is found, the supposition that it is a somatic disorder will be inevitably refuted.
falsifiziert. So eine Systematik
Such a classification will be provided from the old Far East medicine. Through this, the supposition of somatic disorder is refuted.
betrachtet man den sogenannten
When we observe the so-called large intestine meridian, we recognize in the shaded areas where the possible pain can arise and where also the pain can expand.
und wo auch sich die Schmerzen ausbreiten können. Zusätzlich kann es
Additionally, the pain can proceed from the large intestine meridian through the gallbladder meridian to the nape.
kommen. Beim Lungenmeridian
We have found out that the lungs meridian controls the pain in shoulders, forearm, and pollex flexor muscle.
beherrscht werden. Beim Gallenblasenmeridian
With the gallbladder meridian, a pain trap is recognized. Secondly, also for example, the sore area of the so-called hypochondrium rib cage. This is also the origin of the name hypochondriac.
Hypochonder verursacht.
With the next meridian, pericardium meridian, possible pain expansion is recognized, which can imitate heart attack. With the kidney meridian, it is recognized that the pain arises on the inner ankle, expands from the calf to the femur, and all the way to the groin. With the urinary bladder meridian, I would like to point out two especially important areas. Firstly, the so-called deep-sitting back pain, and secondly, the area of the so-called nape pain, which stretches all the way to the scapula. Now, with the help of these meridians, we are able to define the quadrants. If just one quadrant is affected, we speak of a fibromyalgia syndrome stage 1. If two quadrants are affected, we speak of a fibromyalgia syndrome stage 2. The two quadrants can, however, also be affected on one side of the body. Then we speak of a special case, namely a half-side pain. There is also another special case when the quadrants are affected in a diagonal pattern. Then we speak of a fibromyalgia syndrome stage 2 diagonal. Then the disease expands and affects 3 quadrants. And the final stage is reached when all the 4 quadrants are affected. That is the so-called fibromyalgia syndrome stage 4, which was formerly called generalized fibromyalgia syndrome or generalized fibromyalgia. Now we can define 4 areas which act as switchboxes of the meridians. In each of these 4 areas, one operation can be implemented. For example, the operation can be done in the inner ankle or in the forearm, either right or left. If we want to understand the causal chain of the disease, we have to go to the initial source. Physical overloading is a basis for the somatic stress. Mental overloading is the basis for the mental stress. In both cases, stress hormones are produced, for example, adrenaline. The hormones cause the alarm state of the peripheral nerves. When the alarm state lasts, a defense reaction of peripheral nerves occurs. They build a protection shell of tertiary calcium crystals around themselves. The following pictures show in the microscope range the protection shell around peripheral nerves. Leukocytes are attracted by the calcium crystals because they appear as foreign matter. The leukocytes' glutenizing activity starts the local inflammation cascade. These local inflammations cannot be proved in the peripheral blood and cannot be displayed with any picture-giving procedures. Nevertheless, they still exist and cause a collagen formation and a scar. There are histopathological findings of tissue samples which were taken from 101 patients. The picture shows the inflammation. In the second picture, we can see the inflammation and a hyalinosis in the tendon tissue. The picture 3 shows the hyalinosis in the tendon tissue with an oedema, a swelling of the tissue. In this picture, another color scheme was chosen. It is the Van Giesen staining, in which the collagen has a red color. The collagen is the basis of the fibrosis. This is again a hemotoxylin eosin staining, which shows fibrosis and hyalinosis. This is the hyalinosis of tendon tissue with the fibrosis, again a Van Giesen. In this nice picture, we can see how the fibrosis, in other words the collagen, here red-colored, penetrates into the brown muscular tissue. Here we can see a fibrosis and hyalinosis, whereas at the same time the adipose tissue, which can be recognized in the small vacuoles on the left, undergoes a scar fibrosis. This picture shows a lipomatosis and also muscular tissue turning to fat with vacuoles forming. Again, we can see here the hyalinosis of tendon tissue with more extensive myelonecrosis. And this is, I believe, the most important picture. It shows one small peripheral nerve, which is separated from the collagen and compressed in the scar tissue. Pathological histological findings have the legal validity as expertises. Here is an example. We see an expert's statement undersigned by an appropriate pathologist. 101 such expertises were synoptically analyzed. Following statements appear. Multiple statements explain the fact that the sum of listed findings is larger than the sum of 101 expertises. Here are the findings which are important, highlighted with colors yellow, pink, and green. The optical processing of the information shows that the name fibromyalgia was chosen reasonably. The division into the 3 stated colors can be seen again. It is a basic neurological, neurosurgical, and hand surgical knowledge that scars, in an acquainted way nerve compressions, produce syndromes, so-called entrapment neuropathies. A lot has been written about the continuity between the compression of peripheral nerves and the pain origination, for example in this book published by Mrs. Sommer. On page 39, we find comments which say that nerves can be compressed by soft structures.
Komprimiert werden können auch von weichen Strukturen.
On following pages, we read that the pain can occur in the brain without any corresponding stimulation in the periphery, just based on the fact that the nerves were compressed.
Stimulus in der Peripherie stattfindet, nur auf der Basis der Tatsache, dass die Nerven komprimiert werden.
Small nerves in acupuncture spots, we have to imagine these nerves as small as nerves in dental roots, go through a mechanical compression, resulting in a neuropraxia, or at the most, an axonotmesis. The damage to these nerves is reversible. The time needed for the nerves to heal is different. It takes 3 to 40 months. This information can be found in every textbook for neurosurgery. Patients operated on by me generally need at the most 12 months. However, I have also had patients who had to wait 18 to 24 months for the nerves to heal. Injured nerves on the acupuncture spots cause exactly the same symptoms and disease appearances as that for which they had been injected in the non-injured state during the acupuncture. Example: when a nerve is injected in an acupuncture treatment of a headache, this acupuncture spot will produce headaches if injured. I call it a reversing effect. This reversing effect is known in homeopathy. We speak also about so-called dose windows. As well, a primary retrogression is known in homeopathy, which means a retrogression of disease symptoms when the patient gets the right medicament in the right dose. Such a retrogression occurs also after a quadrants operation, especially when there is a long-standing pain syndrome. This basic knowledge, which I have talked about until now, opens the way to a causal treatment of fibromyalgia, allodynia, and the somatic pain disorders, which are falsely called fibromyalgia. So it can be determined in which quadrants the pain syndrome had its beginning and which quadrant is the worst. The quadrant pain is now accepted in mainstream medicine as well. The quadrants are explained in the Zenz-Jörner standard writing. Here we can see a clear illustration of left upper quadrants and an illustration of afflicted right body half. Further, the quadrant pain is also used during the examination of so-called complex regional pain syndromes. When we know the quadrant pain, we understand also the quadrant pain and the half-side pain which occurs at CPRS. The complex regional pain syndrome is nothing else than a post-traumatic fibromyalgia, which arises from the side where the injury, for example after a work accident, occurred.